for the Tele-Town hall meeting. It's just an opportunity for me to interact with my constituents, and I know many of you have participated in these calls before, and I find them very, very helpful. I actually get good feedback when I'm in the district of people that had a chance just to listen in and tune in for a little while, and also ask questions yourself. And by the way, any time tonight, if you want to ask a question of me, no matter what the issue might be, just dial *3 on your telephone, and you'll automatically get put into a queue, and we'll be sure to get to your question as soon as possible. I think we're going to spend the bulk of the evening tonight just probably talking a little bit about health care because, as you probably know, Speaker Pelosi released the latest health care reform bill at the end of last week, and we are expected to debate and vote on this bill sometime later this week. There's some things I think that a lot of people should know about this bill. We're still trying to decipher exactly what's in it, and that's because it's nearly 2,000 pages. In fact, it's 1,990 pages long. It's actually almost 1,000 pages longer than the first health care bill that was introduced just before August, and that was a very controversial bill in itself. We actually took today several copies of the bill. If you're interested in taking a look at it, we took them to the county libraries in our district, at the Hennepin County Libraries at Brookdale, at Ridgedale, and Southdale. There's also a link to the bill on my website at www.paulsen.house.gov. I just think it is really important that not only members of Congress and their staff have a chance to read and peruse through this bill, but that members of the public have a right to know what we are going to be voting on. And this is much going to be ballied around, I think, in the coming days, in the news, et cetera. But there are some things that I don't support. There's a couple provisions that are good things in the bill, but by and large, the negatives, I think, outweigh the positives. And let me just explain where I'm coming from there. Again, this is Congressman Erik Paulsen. If you're just joining us tonight, I want to thank you for joining us on the Tele-Town hall meeting tonight. If you have a question at any time, I just want to encourage you just to dial *3. We're also going to take a little poll a little bit later just to kind of feel for me to get a sense of how you feel about the current health care proposal that was introduced last Thursday. Again, it's an almost 2,000-page bill. It's a very prescriptive bill, actually. I think the word shall, which means must, it's what you must do, is in the bill 3,425 times. So it is very prescriptive. There are individual mandates in the bill to carry insurance with penalties if you do not on tax equation. There are penalties on small business if they don't provide what is deemed as adequate insurance for their employees, and those definitions are not laid out or are not very prescriptive right now, but there are a lot of, I think, vagaries where the new federal health commissioner, or choice commissioner, I guess, would have the ability to make the decision if something is providing adequate health insurance or not. So I am very fearful that this is actually going to bill. In fact, a lot of pundits have already agreed that it's actually going to increase health care costs. It's not going to save costs. Now, this bill that Speaker Pelosi has introduced really addresses more the issue of access, because there's a group of the population that does not have access to insurance, and that's been part of the main reason for health care reform, at least from Speaker Pelosi's viewpoint and the Democratic majority. But I really maintain we need to focus fundamentally on the cost issue, and there are several things I think we should be talking about that, such as allowing small businesses to pool together to buy insurance and allowing young adults to be staying on their parents' policies for until maybe age 25 or 26. I think that's a component in this bill, actually, which is a good thing. And again, if you want to ask a question tonight, just dial *3 at any time, and you'll get a chance to be able to ask a question. I also think we should be looking at medical liability reform and tort reform. I tell you, in all the doctor's visits that I do back home and visiting with clinics and hospitals and a lot of our healthcare forums, defensive medicine does come up quite a bit as a cost driver in the equation for medical malpractice costs. And it's not the only answer, but it's certainly a component of some of the higher costs that are facing the medical community. And that does get passed on to all of us. The other flaw that I think that the bill has is that it is based on an entitlement program, Medicare. And many of you may know, because Washington's been out of control in spending, this bill will spend on a new entitlement program, literally spend on a new entitlement program when Medicare is going to go bankrupt in just 8 years. And, right now we've got Social Security, you've got Medicare, you've got Medicaid, and these are all federal entitlement government programs that essentially have been mismanaged and not run very well, and they're all going to go bankrupt. And so it doesn't make any sense to me to just impose a brand new federal entitlement program when we don't have a very good track record in Washington of dealing with this already. As I mentioned earlier, it is basically a $1 trillion bill, I think is the latest score now that the Nonpartisan Congressional Budget Office has given the bill, which is a huge expense, $1 trillion, and that actually is paid for, at least it looks like it's being paid for, by about $500 billion in cuts to Medicare, and that's really going to affect a lot of folks in the 3rd Congressional District in particular, because Medicare Advantage programs are going to go by the wayside, and we've got 19,000 and some seniors in the 3rd District alone that are going to lose their Medicare Advantage programs. And I've talked to a lot of seniors. In fact, one came in my office not too long ago, and she left a little teary-eyed because she was very concerned that she was not going to have the same health insurance program. And, that statement's been used a lot. If you like your health insurance, you should be able to keep it. And that's not going to be the case under this health care plan that's being discussed in Congress. And we will be taking a vote, it sounds like, later this week. It could be on Thursday, could be on Friday, it could be on Saturday. It sounds like the Speaker you need 218 votes to pass a bill, and right now they're at about 200 votes. So they're literally clawing their way towards 18 more votes to try and pass this large 2,000-page bill before the end of the week. And so I just really think it's a mistake to ram something through. I know there's going to be a lot of vocal opposition from the public, as we saw during August and September, and I think that quieted down a little bit as Congress started to pull in the reins a little bit and look at health care in a different way. But now they're going right back and passing the same bill. Again, if you want to ask a question, just dial *3, and you'll have a chance to be asking me a question right away. And we're going to get to our questions right away tonight because we want to get through as many as we can. And if I can just ask you, please, keep it short, keep it simple. We'll keep moving through, and it just helps me get your advice and thoughts. So I think we've got Cheryl on the line. Cheryl, are you there? There we go. Cheryl, are you there? I think we may have just lost Cheryl. Well, I think we'll have a chance to go on to Peter, if you're there. Peter, are you there? Yeah. I think we've got Peter on the line.
Hello.
Peter, thanks for waiting.
Great. Hi. Thank you for the opportunity. Real quick, our family's a fairly well-off family. We spend about $15,000 a year on health care, which is not very good. So they could raise my taxes $15,000, and I would be breaking even. My health care is not very successful.
Okay.
What are your thoughts?
Well, and that's actually an issue for a lot of people on health insurance is the cost equation. And I really think that the best way to address the access side of the equation and getting more people covered is to help lower costs. And unfortunately, the bill does not address the cost side of the equation. For average middle-income families in particular. I know there's cuts to Medicare in there. There's some hits on small business because they're going to raise taxes on small business, et cetera, in order to pay for this program. But by and large, we should absolutely be able to provide more coverage on the access side if we can successfully lower costs. And we can lower costs. It's been shown that we can lower costs by allowing interstate competition. You can buy health insurance across state lines, just like you can buy your auto insurance. If you can allow small businesses to pool together and spread out that risk, that will absolutely help as well. Medical liability reform, as I mentioned earlier, is a component, not the only answer, but is certainly a component in helping lower the costs. And I think one of the fundamental things that I think is critical that we absolutely should have for health care reform is, number one, covering pre-existing conditions, and number two, having the portability. So if you lose your job, you're going to be able to keep your health insurance. That is something that is really, really important and fundamental because a lot of people I talk to right now, they're worried about keeping their job or losing their job in a tough economic environment, but most of them want to keep their job, particularly to keep their health insurance for those 60-some million Americans, I believe, that have health insurance covered through their employer. That number is going to go down a little bit probably under this bill because more people are going to opt to go into this new public-run program rather than have it covered through their employer. So health costs are absolutely an issue that need to be addressed. I just, unfortunately, it's frustrating for me to tell you this. The bill is not going to address cost to save that $15,000 per year. In fact, for a lot of small businesses that actually are able to save money by offering healthcare savings accounts or FSAs or other programs like that, those programs are now going to be taxed as well and will make it more difficult for a lot of these smaller employers that are providing health insurance for their employees. So Thanks for that question. I think we've got Jacob on the line. Jacob, are you there?
Yeah, I'm here.
Thanks for waiting.
Yeah, thanks. I have two questions. One of them is, what can we do to stall or stop the passage of this bill if we're not supporting it? And then the second thing is it just me, or is there a real misinformation going out when they say that it's a public option? But the fact of the matter is, every person is going to be taxed to pay for the so-called public option. So it's not actually going to be an option. It's going to be an option to be served by it or not, but everybody's going to have to pay for it.
Well, and that's actually been raised, and the devil's in the details. And in fact, even if this public option is there as an opt-in or an opt-out, I don't think it makes any difference, because eventually, down the road, the taxes go in place immediately. I mean, right away in January. But health insurance program provisions do not start actually for 4 years. And so they're going to be collecting the revenues to pay for this very early, whereas the benefits are not going to be paid out for a period of years. And so it is a hugely expensive program at a time when Washington is overspending in a variety of areas. And that's a whole other discussion that I could have. But you asked about what can you do to particularly help. I have to tell you that this health care debate will be decided by public opinion. And you're already doing that right now, of course, by being engaged on the phone tonight, taking the time to ask the question. I appreciate that. But I think people really do need to talk about this with their families, with their friends, with their neighbors, and have a reasoned discussion. It's not about yelling or some of the other things you might have seen on television, but then they need to contact their members of Congress and share how they feel. And I talk to people that are advocates for a public option and for a single payer. I mean, there aren't as many, I think, given the current debate right now. I mean, just to be honest, the town hall meeting I had in Maple Grove, we had 600 people show up on a Friday football night. I mean, by and large, the vast majority of those people were not for this plan that's moving through and has now been reintroduced and moving through again. So you're doing exactly the right thing, but it's very important to get people engaged, because I think Congress is going to try and pass this through at the end of the week, almost through the dead of the night, if you will. And the other fundamental difference I want to mention is that members of Congress still are not going to be required to be under this plan. And it just makes absolutely no sense to me. If it's good enough for the American people, it should be good enough for members of Congress. And that actually needs to be fixed as well. So I appreciate that. I think we've got Mary on the line. Mary, thanks for waiting.
Hi. Thank you. My question is mainly, why are the Republicans more concerned with stopping this rather than coming up with a package of their own that truly helps people? I have good coverage. I cannot complain. But I know all too many people, and especially young people, who do not have coverage, and it's really terrible. They are building up horrible bills. I think that the Republicans need to stop fighting so much to halt this bill and be productive and find areas that they can support, and let's get it passed. When money was spent for the war in the Middle East, there wasn't any problem. Spend,
right.
Do it. And so I think that if we get the bill passed, then we can fine-tune it later, and we can figure out how to pay for it later. I think we're concerned with people, and they have to be helped. Thank you.
Well, and thank you very much for that comment. And, I just want to tell you right away, I couldn't agree with you more about the need to address the problem. And, there have been some Republicans in the past that said, you know what, we're in the minority. It's not our job to come up with alternatives. It's not our job to find a solution. We just need to defeat whatever they propose on the other side. I do not subscribe to that view. I really believe that I was sent here to work bipartisanly, to work for common sense approaches. And I don't think that Speaker Pelosi's bill is a common sense approach to addressing the issue by any means. It's vastly expensive. It cuts Medicare for seniors. It's going to hurt small business at a time when our economy is going through some tough times. But I'm actually on different legislation with Democrats that is very bipartisan to allow those small businesses to pool together and spread risk, having that interstate competition model where you can buy from just more than 3 health insurance providers in the state of Minnesota. You can actually shop around a little bit. That's going to help bring down costs. And as you mentioned earlier, the young people issue. I mean, having young people be on their parents' policy while they're young adults. I mean, that is absolutely something we can do to make sure that young people are not only encouraged to buy insurance, but they actually get it. And they're not just going to the emergency room, when they think they're young and indestructible and they're not buying health insurance. So very good points. But I want you to know that I really fundamentally believe it's important to have health care insurance solutions. I just think this is a very wrong-headed approach, unfortunately. So thanks for that call. I appreciate it. Again, this is Congressman Erik Paulsen. If you want to ask a question anytime tonight, just dial *3. It doesn't have to be on health care, but I know that's what the vast majority of our discussion is going to be on tonight because there's such a huge amount of focus and attention on this bill. Almost a 2,000-page bill. And if you want to look at a copy of it, we brought copies to your local library today in Brookdale and Ridgedale and Southdale. We also have links on my website tonight. You can go there directly at www.paulsen.house.gov because we wanted to make sure it was available. And I'm actually going to be working on a number of amendments, too. In particular, I'm working on a number of amendments that are going to strip out the innovation tax on medical devices. For instance, I've been working on that issue as co-chair of the Medical Device Caucus, Technology Caucus. We had a field hearing in Minnesota just a couple of weeks ago, and companies came and testified, and these were not the big companies, these were actually the small companies that testified about if this tax passes, a $40 billion proposed tax in the Senate, a $20 billion tax proposed in the House. If this passes, they will take it out of payroll. They'll have to take it out of their R&D and out of their payroll, and they're going to have to lay people off, and that's just not a good thing when you got these companies that are employing people with good jobs, really high-paying jobs, actually, and they're trying to come up with the next best life-saving technology that you or your parents or your kids, children, are going to be able to use someday. So I think that's a problem we have with the approach as well. Thanks much. I think now we've got our next question. We've got Ryan on the line, if Ryan's there.
Yep, I'm here.
Thanks for waiting.
Yeah, thanks so much for letting me ask my question. Earlier you had mentioned that they need about 218 votes and that they're at about 200. Is that correct?
Yeah, that's the word we hear, the unofficial word, correct.
Well, who are the 18 that they're courting for the vote that we can call and basically encourage them to vote no on this bill?
Yeah, well, and first of all, it's a good question. I mean, I can't give you an exact name, and here's the only reason why, is that there are a number of the so-called blue dogs that I think we've read about and that you've probably read about in the newspaper, and these are the more conservative Democrats, quite honestly, that are in the majority, but they're not agreeing with the speaker. They're not agreeing with her position of having such an aggressive, expensive plan, and they're more fiscally conscious. So there's about 40-some of these members right now, and a lot of them come from the southern states, for instance. Tim Walz, from Minnesota, is a member of the Blue Dog Coalition, and I'm not sure where he's at in the bill. You have to call his office to find out. But it's those blue dogs, I think, that ultimately are going to make the decision because, Republicans cannot stop this bill. That's not possible. There just aren't enough Republicans to stop it. So whether it's the president or anyone else saying Republicans would be killing his health care bill, that's false. In fact, Senator Lieberman in the Senate and Senator Ben Nelson from Nebraska are the two recent senators on the Senate side that are kind of holding up the process because they're very concerned about the fiscal ramifications of the bill. So I would just really encourage you to call your U.S. senators, because obviously I represent you in Congress, but that should not prevent you from reaching out to your U.S. senators, both of them, as well as other members of the Minnesota delegation. I think, and again, if you reach out to friends and family and relatives, coworkers, these folks all live in many, many different districts, and they're going to be able to reach out, which I think is very much important. So thank you very much. Great question, and I think we're going to get a lot more questions about health care tonight. We've got Carol on the line right now. Carol, are you there?
What was the name?
Carol Montgomery?
Yeah, okay, hi. Okay. I'm opposed to the health care program, totally. What I think it's going to do is decrease quality of medical care. And my husband has a medical device.
Okay.
And that's one of the things that's keeping him alive. I don't like the way they're handling Social Security, of course, to seniors. It's not livable. but the economy has been so lousy with investments that we've all lost tremendous sums of money. The only thing this is going to do is cost the seniors out of being able to afford insurance, decrease in quality care, and it's going to create a whole new generation of street people or homeless people. I've already run into physicians that will not take Medicare patients because of the cuts that they have to take in their fees for coverage.
Sure.
Social Security was supposed to have been put into a trust account. It has never, ever been honored. I'm just scared silly about survival and health care.
Well, and Karen, I mean, actually, the issue you raised, I mean, about Social Security and even Medicare, I mean, these are programs that were put in place a long time ago. There's no secret that even with the trust fund that you mentioned, that these programs are scheduled and fundamentally are going to go bankrupt at some point. Medicare will go bankrupt first in just 8 years. I mean, that's the reality with unfunded liabilities as the population gets older. Under the existing programs we have right now, that's going to be the reality. And, you know, this new public plan as a part of this 2,000-page bill is going to include a new payment plan based somewhat on Medicare. And so it's going to be based on a false and a failing system right now, which, again, just does not make any sense from my point of view. So, again, great comment, great questions, and just want to encourage you to really be able to, think long and hard about every provision of this bill in terms of what you see in the newspaper or how you react to it, maybe what you see on television, and ask questions. It's really important to fundamentally ask questions because things can get blown way out of proportion. But I do know there's a group of members in Congress on both sides of the aisle that are very interested in working in a bipartisan manner to come up with some more thoughtful approaches. I'm hoping the Republicans will be allowed to offer a substitute alternative. It's not a guarantee because the Speaker has to give permission for that to happen. So even though a lot of people in the public think that Congress is some grand debating society and every idea gets debated, that's not always the case. The Speaker has to give permission for an alternative to be offered and voted on. And I think that's only fair from the standpoint of the American public being sure that they're going to be able to see some options. So thanks for that. I appreciate that very much. And I think we've got Mindy on the line. Mindy, you there?
Yep, I'm here.
Thank you.
Hi. Quick question for you. If this bill were to pass, what happens to chiropractic care and alternative health care?
Well, that's a good question, actually. I don't know the exact answer to that, and it's probably something we probably need to pour through more of the bill. I mean, I just started reading a little bit of the bill before the weekend, and my staff's been pouring through it. And so on alternative health care and on chiropractic care, I don't know the answer to that question, and I'm going to make a note because we're going to look into that in the next couple of days. And if you have any advice or thoughts on that, I want to make sure that you pass that on. I do know that chiropractic care right now is included in some state mandates on insurance programs that are out there right now, and I just can't tell you the answer on what it's going to be for this plan.
Well, I know that, where I work in a chiropractic office. We have the Minnesota Chiropractic Association and the American Chiropractic Association that is setting up certain funds to try to get chiropractic to stay within, as an option for health care.
Okay, all right.
So if you want to check out, the MCA or the ACA, there should be more information on that. We have actually some flyers up at work for people to sign if they want to keep chiropractic care as part of their health care.
Okay, I will absolutely check that, and I know that I, in particular, have been sponsoring some legislation for access for chiropractor for VA plans, for instance, and I've met with members of the Minnesota Chiropractic Delegation. So, I mean, that's great feedback. I appreciate that.
No problem. I hope that it stays as part of an option.
Okay, well, good. Well, thank you very much.
Thank you.
In just a little bit, we'll be able to just maybe take an informal survey of where you might stand on this bill. But again, just to remind people, it's almost 2,000-page bill. It weighs about 20 pounds. I think if you take out the cost of the bill, it's about almost $2.5 million a word. The word "shall" is mentioned 3,425 times, which means, again, it is very prescriptive. I've heard a lot from my constituents over the past couple of months. I really value your input on this important legislation. This is no doubt a bill that is going to affect the life of nearly every American for decades to come. And I take that responsibility and that trust you've given me very, very seriously. And again, I think health care in this country needs reform. But this massive bill, to push it through by the end of the week, I think will drastically expand the role of government. It's going to raise taxes on small businesses. There's no doubt it's going to put a heavy burden on seniors as well as a financial burden on future generations, my kids and your kids, for instance. So thank you very much. I think we've got Sarah on the line. Sarah, are you there?
Yes. I had a couple of questions. First of all, two things that Americans use now are flexible medical spending accounts and health savings accounts. I know my family has moved over to an insurance plan that is a health savings account, so the bulk of everything that we pay for medically in a year is cash on the barrel for us. But we have an account that is tax-free money that we set aside to be able to use. And I'm concerned that some of the verbiage in the bill may be considering taxing that money that we set aside for medical expenses, as well as for people who use flexible medical spending accounts, maximizing how much you can even put into those accounts. And then there was some verbiage in there, too, about how they're going to limit what we can count as a medical expense, particularly, say, prescription versus over-the-counter medication. Say somebody who has a heart problem who has to take aspirin on a regular basis, or, various allergy medications that would have been not considered medical expenses now won't be. And then the last thing I just wanted to comment on is history has shown that other medical plans that our government has run, i.e. Medicare, et cetera, have gone way far and above original projections. And how we can possibly believe this time that this isn't going to go above and beyond is unimaginable to me. And will Representative Pelosi promise that, when we reach that maximum, we'll stop spending? Because I doubt that that's something that they would be willing to commit to.
Well, and let me just go back, and thank you, Sarah. Let me just go back. You mentioned the HSAs and flexible savings accounts as well, and there's no doubt, and you hit it right on the head. You would not be able to purchase over-the-counter medications with an HSA under this legislation. So, regardless if you need to be taking aspirin for a stroke prevention or heart condition, no matter what it might be, and there's a 20% penalty for non-qualifying expenses. That goes up from 10%. So there are significant penalties in this bill. And you're right, this is one of my biggest concerns about this legislation is there's no doubt that past history shows the federal government just has a very poor track record of scoring these pieces of legislation accurately. It is only going to increase over time in terms of the overall cost, just as Medicare, Social Security, and other things have done. And it's going to be a huge burden down the road. And again, a lot of small businesses that I've been meeting with in particular are very concerned about the mandates that are going to come down on them, as well as the tax provisions, because about 1/3 of all small businesses will have to pay a tax to help fund this program. So it's going to be, it's a heavy burden. 1/3 of all small businesses. This is where 70 to 80% of all jobs come are from small business. So it's not just the Best Buys and Targets and their good corporate citizen companies that we come to know in Minnesota. It's small business that has really led the way for economic growth, and they're going to get hit pretty hard. Not to mention the seniors, of course, that are going to have to pay for some of the insurance. So appreciate that very much. Great question. I think we've got Mike on the line. Mike, are you there? Mike, are you still with us?
Hello.
Hey, Mike, how are you?
All right. I had an earlier question about what we can do, and you answered that to some extent. I would like to compare this to food stamps, that getting the government in this isn't necessary, and we can still take care of people who need to be taken care of, and provide insurance and medical care without having the government grow the food, as it were. Sure.
Well, and, I'm sorry, I'm having trouble hearing you, so I better just make sure I get that question. But, that's a very good point. And, the truth is, the government is not going to be able to provide health insurance from an innovative standpoint. very much at all. In fact, that's one of the criticisms I have with the proposed tax on medical devices that come from states like Minnesota, for instance. So, we are literally going to be penalizing innovation in the marketplace. So, all these companies that are putting money into R&D, they're hiring people to do research and development for these life-saving technologies, really to give peace of mind to a lot of families, not only for caring for their parents or grandparents, but also for their children in many respects. And we had some patients come and testify at a field hearing that we did in Plymouth just a couple of weeks ago, in particular, that received prosthetics as an example. And they talked very straightforward about this is going to increase the cost for patients because it's going to get passed directly on to the consumer. So rather than people getting prosthetics or certain limbs that might allow them to have a better quality of life, they're going to be put in a wheelchair. And on top of that, wheelchairs are going to have an increased tax as a part of them. Hearing aids are going to have an increased tax as a part of it. So I just think it's important to kind of raise those issues so we're very, very clear about it. I think we've got Mark on the line. Mark, are you there?
Yes, I am. Thank you, Congressman.
Thanks for waiting.
I've got 3 questions. First of all, I've understood that there is funding in this bill for abortions. Is that not true?
Well, there's a lot of question, actually, about the actual language. Now, the way the bill stands right now is that it does reverse what has been, again, decades-old law back to the 1970s where federal funding of abortion has not been permitted. Taxpayer funding of abortion has not been permitted. There's some open loopholes in the bill the way it's addressed right now.
Okay. And I understood there is some pro-life Democrats that have said they will not vote for it if there's funding in there for abortion. Is that also true?
That's correct. There are some members of Speaker Pelosi's caucus or conference that have expressed that exact issue, saying that, since 1970s, again, this has been a longstanding policy, bipartisan policy, to not have taxpayers pay for abortion, and that should be and they want an up and down guaranteed vote to make sure that there's going to be a vote on that issue, and the Speaker is not committed to giving that up and down vote yet.
Okay. Do you know how many Democrats there are on the pro-life side?
Actually, I do not. I can only tell you that Congressman Stupak, and then I'll let you move on. I'll take the next question. But Congressman Stupak from Michigan has been the leader of the so-called pro-life Democrats that you just mentioned, and he's the one that has been asking for and sent a letter to the Speaker saying, hey, we just want an up and down vote. If he loses the vote, I don't think, he's not, he's going to vote his way, but he's okay with losing the vote. He just wants to make sure there is a vote, and it's not just going to be forced through without having a vote on that issue. So, personally, I don't support allowing federal funds for abortion. And again, Congress has a long history of not allowing funding for abortion through taxpayer dollars. I'd prefer to see that remain the case. I know that there are some, like Speaker Pelosi, that want to change that, and I'm hoping that about 40-some members of Democrats, I think, that signed with Congressman Stupak from Michigan, will be able to prevail. And again, just to be able to have an up and down vote on that, I think that's only fair. I mean, we're all sent here to vote, and it's certainly worthy on a health care bill like this of having more than a three-hour debate on something that is going to be probably the largest federal policy that has been proposed or enacted since the 1960s. So a very significant bill. I think we've got Marge on the line. Marge, are you there?
I'm here.
Hey, thanks for waiting.
I have one major question, and that is I'm concerned about what kind of cuts they're talking about making it to Medicare other than Medicare Advantage. Do you know what those are?
Okay, like additional cuts other than just Medicare Advantage?
Yes, the regular Medicare.
Well, actually, I mean, Medicare Advantage for sure will be reduced or eliminated, essentially, is what's going to happen. So it's about 19,000 seniors. I think we got 50,000 some seniors in Hennepin County, but about 19,000 of those seniors come from the 3rd Congressional District. In addition, there I know are some, essentially the new bill that just came out. I mean, we don't have all the details, but I think there's also some language in there that talks about prescription drug benefits may go up on Medicare Part D. At least that was the case under the old bill. So we're trying to decipher and see if that is actually the case. They said about 20% increase on prescription drugs. But basically, it is literally a $426 billion cut to Medicare as a part of this bill. So, I mean, it's going to have to come from somewhere. It all can't come from Medicare Advantage. It all can't come.
Are they cutting Medicare services?
Well, I think the way that they end up cutting services is by squeezing doctors and saying, you know what, we're not going to reimburse as much for Medicare treatment. So then the doctors are going to end up, not covering Medicare. And that's what's actually happened in Minnesota. Unfortunately, it's been very unfair for a state like Minnesota. And bipartisanly, our whole Minnesota delegation is on board on fixing this. Unfortunately, they're only going to study it as a part of the bill, what's been going on with Medicare. They're not going to actually do anything about it. And so that's my biggest frustration is that, I would rather just do something about this rather than study it any longer, because we already know that if you live in Florida, you can fly to Minnesota on an airplane, turn around and fly back to Florida, and it's cheaper if you just were treated here in Minnesota. It just doesn't make any sense. So, again, great question. I appreciate that. And we'll have to stay tuned on that down the road without any doubt. Again, I want to thank all of you for taking the time to join tonight. We're going to keep taking questions, but I just want to mention that if you have a question, dial *3. First of all, you'll get put in the queue. We're trying to get through as many as we can tonight. We got a lot of people lining up to ask a question. I also want to let you know that if you have an opportunity, you can always visit my website. We've got a healthcare survey on there. A lot of you filled out the healthcare survey that I mailed to your home. We mailed one out to seniors as well, which has been great feedback from me, because that's what really helped us identify how many people are covered by Medicare Advantage programs. And that feedback is really helpful, because I've gotten some really good stories and anecdotes from people that are affected by health care. Some are not being covered with pre-existing conditions right now and not getting health insurance coverage. And so I support covering that, much like some states like Minnesota was sort of a pioneer in that area in terms of covering with these larger risk pools that actually is using government to help provide that service. I think that's totally appropriate. But you can do that without throwing the baby out with the bathwater and kind of starting all over with a brand new massive program that's going to literally alter health insurance, and affect the other 85% of the people that are covered under health insurance right now, for instance. So I think Lori's on the line. Lori, are you there?
Yep, I'm here.
Thanks for waiting.
Thank you for having me. And I appreciate you having these town halls. It's very nice to see, active members of our government getting our say. So thank you for your time.
Absolutely.
My question is that I hear, I'm more confused on terminology where I hear, members of the press in interviews from people saying, oh, well, people don't have access to doctors. People don't have access to doctors where, they can't, they show up to hospitals and get turned away. Is it a Minnesota thing, or is it actually supposed to be a mandate across the country that if you show up to a hospital or an emergency room, you will be treated? And is it that access they were referring to, or are they truly just referencing access to health insurance?
Well, I think that's usually just access to health insurance, because a lot of people get covered through the emergency room right now, and unfortunately you and I and everyone else are paying for that service. Well,
exactly. But so then why? I mean, they were just talking about, some congresswoman was talking about how somebody died of the flu because she didn't have health insurance and couldn't see a doctor. So well, it's like, I'm just, is that a scare tactic, or is that really true?
Well, and it's hard to say. I mean, there obviously are going to be little cases like that, but equally, I think when President Obama gave his speech to Congress back in early September, he used some stories and anecdotes as well. And it was shown later that he was wrong in one of his anecdotes that he used. I mean, there was someone who, did not die because of some lack of treatment, and that was proven by the press as they kind of looked into it. The truth is, you cannot be denied at the emergency room for anything. I mean, that is the law. That's the way it works. Right. And I'll tell you one example of something that needs to be changed. I went out and toured a hospital recently in Minnesota, and a woman, they had told me the story there, came in the emergency room, and she demanded a pregnancy test. And they said, you know what, if you just go down the street, you go to Walmart, you will be able to get coverage and, get it taken care of, probably for $10 or whatever it costs. And she basically threatened to sue, and the hospital had to back down. Again, that's the law. They'll provide the coverage. And so it ended up being covered through the emergency room at a much larger expense that, again, you and I and everyone else as taxpayers are paying for. That needs to be changed. A lot of that comes from the defensive medicine practices that need to be changed. And unfortunately, Hennepin County Medical Center downtown has huge amounts of uncompensated care that we're paying for through lack of health insurance. But one of the biggest reasons that people aren't covered is that health insurance is too expensive. And so if cost is the biggest barrier, we need to bring down health care costs. And there are absolutely ways to do that. in a common sense, bipartisan manner. And unfortunately, that's not the way that Congress is moving right now. I can't speak to the Senate because they may move in a different direction, but in the House, they're going to try and push through, again, this bill that was just reintroduced last Thursday in particular. So I think we've got Robert on the line. Robert, are you still with us? We may have lost Robert.
Maybe it's Roberta.
Roberta, sorry. Are you there?
Yes. Yes, I have like a question and I have like sort of a comment.
Okay, go ahead.
Okay, and I appreciate being called tonight. I've from what I've gathered this past weekend that this health care bill is really unconstitutional because it's forcing Americans to buy a product that they don't really want. So I don't know how that can really happen if this bill is so unconstitutional. Why don't people in Congress notice that and see it? And then also, right now I pay for my own health insurance every month with Blue Cross, and right now it's $248 a month with a $3,000 deductible, and I like my health insurance well. But I read also that with this new plan coming up, that because of my income level and stuff, I will be charged almost $200 more a month, and I'll be paying about $200 more to be paying about $448 for my health care. Right now, it's better in my own health care plan right now. I don't need the government to help me.
Sure. Okay. Well, thank you very much. Well, first of all, I mean, there's no doubt, and there have been discussions here in Congress, I should say, regarding the constitutionality of some provisions of the bill. And, I mean, there are parts of this bill that raise serious constitutional questions, like separation of powers and some questions about the mandates. I mean, obviously, I have one vote. I have one vote in Congress. I'm going to use that to express what I think about the bill, and I plan on voting against the bill for that reason, and the other concerns that I laid out earlier. So just to let you know, there are members of Congress that are actually raising that issue because there are unprecedented powers that are going to be given. I think there's 100 different new government agencies that are created as a part of the bill. There's a lot of questions about that. We've had a lot of questions about all these czars, for instance, that have been put in charge of large portions of the federal budget that don't have accountability to Congress. They don't get approved by the Senate or confirmed by the Senate, and they get executive privilege. And I don't care if it's a Republican or a Democrat in charge of administration. I think, Congress has to keep its purview of having that constitutional authority of appropriating money. And so that's an issue, again, that's going to get continued focus as well. And I think the health care bill in particular is going to continue to demonstrate some of the challenges there. I want to do one quick chance to have a poll, and just so I can get a snapshot. But based on the conversation we've had or what you know about the bill, if you support the new health care legislation that was just proposed last Thursday, just press 1 on your telephone. And if you don't support it or you think it's the wrong approach, just press 2. It just gives me a good snapshot of kind of where people are thinking and what they're thinking about the legislation. But again, press 1 if you support the legislation is being proposed in the House. We've been talking about the House bill tonight. Or press 2 if you don't.
Your vote has been registered.
Right now, in the House at least. And we'll come back and do that one more time a little bit later. So appreciate that. I think we've got Pete on the line. Pete, are you there? Pete Paulsen?
Yes.
Thanks for waiting.
Pardon me?
Thank you for waiting.
Yes. I have a question. The big question I have: what's going to happen to Medicare? It's just something that they got to keep pretty much the way it is. I don't mind paying a little bit more for the protection, but it's really great to have. Now, the thing is, as far as the hospitals, like Blue Cross Blue Shield, I think they probably could cut that a little bit. But I think that's pretty high I'm paying. And I've had Blue Cross Blue Shield for many years. And when we had our business, we were paying $300 a month. That was for me and another $300 for my wife. And it was good coverage and all that. So I guess I want to see. We need help in the prescription drug area. That's really getting terrible. You go to Canada and get it cheaper than you can here, and this is something wrong there.
Well,
so
listen, Pete.
Change there.
Well, and thank you. I appreciate that feedback, and I tell you, I mean, I am committed to preserving and protecting Medicare, and I can tell just by your comments that you like what you have, and you might be willing to make a few changes, but by and large, you like what you have, and there's no doubt that those drug issues is the prescription drug issues has been an issue for a lot of seniors in our area, in particular in Minnesota, being on the border of Canada. Thankfully, I mean, when the Medicare Part D program got put in place several years ago, it took away a lot of that issue in the sense that drugs were provided for a lot of our seniors, which was important, obviously. I mean, there is one good provision in this bill that I do like, and, it has a cost expense to it, but the donut hole that exists right now for seniors on Medicare is closed. By 2019, that will be closed. And so, there's going to be a 50% discount on brand name drugs, et cetera. So it moves in a very positive direction, without a doubt. But the reality is that, there's 143,000 people that are eligible for Medicare in the 3rd Congressional District in Hennepin County. And those people are going to see reductions, especially Medicare Advantage, of hundreds of billions of dollars in cuts to Medicare. That's a significant amount of money and potential change in service that you have with your current physician and your current provider, whether it's Blue Cross Blue Shield or anyone else. So that's a very significant issue. Again, I want to thank you for taking the time to join tonight. You want to ask a question, dial *3. And I should mention right now, if we don't get to your question for any reason, because we usually do these Tele-Town halls for about an hour, be sure to just stay on the line, because you can leave comments or a question, and we will guarantee to get back to you within 24 hours. I'll have a staff person. I listen to the comments and concerns. I can send you back a note or an email or a phone call, whatever I can do to help. Again, get your feedback. It helps me. So I appreciate it very, very much. Thanks much. I think we've got Don on the line. Don, thank you for waiting. Don, are you still there? I think we might have lost Don. So I think we've got, we might have Arlene on the line, if Arlene is still managed to stay with us. Arlene, are you there?
Yes.
Hey, thanks, Arlene. Thanks for waiting.
Yes, Erik. Well, there are so many things in this that I oppose, certainly the public option, but also I'm wondering, is abstinence education included in the, in the schools?
Oh, you know what? Not to my knowledge, actually, because, I mean, this bill is just addressing with health care issues in particular, so I'm not aware of anything that's addressing any school issues or education issues, but we'll check. I mean, we've actually been doing
it would be the health, the health issue in the schools because of the sexually transmitted diseases and so on. And so I would like to know that.
Okay, well, listen, we'll be sure, because our staff has been doing literally searches by word. We can do word searches on the bill and the text, so I'll make sure we get back to you and let you know, because we've got your contact information, and we can just get directly back to you on that, and it's very easy for us to do. And if anyone else has other questions about certain provisions of the bill, I mean, let us know, because we can help search that. Of course, you can go online and download a copy of the bill, and I wouldn't recommend printing it off, because when we did that in my district office last Friday, they wouldn't let me take it home on the airplane because it wouldn't fit in the overhead. It was so big. But it took like 25 minutes to print off, like 4 reams of paper. So you can certainly do that. I wouldn't recommend it. You can go to the library to take a view of it without any doubt. But just wanted to mention that. I think we've got Claudia on the line. Claudia, are you still with us?
Yes, I am.
Thanks for waiting.
Sure. I'm listening to all these comments, I'm struck by the fact that people are unhappy with what we have now, so I sure hope we do have some kind of health care reform, because it's important for everybody. But I was wondering what you would propose, or what you know that is proposed in this bill for people who are unemployed for absolutely no.
health insurance is not connected to employment.
Right. Right now, the options are terribly expensive and unaffordable. And if the unemployment provision or whatever it was called from February, where if you COBRA right now, you pay 35% of the premium. If that expires at the end of this year, I don't know what my family will do for health insurance.
Right. Well, and thank you for the question. Actually, the other issue to keep in mind is that, and I'm sure you know, COBRA is very expensive. So, that's a very expensive hit on your family out of personal income, from a pocketbook standpoint, I'm sure, for your family. And, I was an advocate for not taxing those benefits as an example, and it's a huge expense. One of the things that can be done, and I think should be done, is to have equality in the tax code. And I say that from the perspective of, if you get health insurance through your employer right now, your employer, like a larger company, it could be, again, a Best Buy or Target, whatever it might be, they're getting a deduction off of for a business expense. They get a deduction for that. If you are an individual, it could be a small business, you're an S-Corp or a self-employed individual, or you're just, an individual that decides to get health insurance, you do not get that benefit for deductibility. You don't get the same exact tax benefit. And I really think, for out of fairness of the tax code, everybody should be treated equally. Individual, all the way on down the line, whether you're employed at a corporation or not, it shouldn't make any difference. And, affordability credits based on income, I think, are totally appropriate to allow people to buy health insurance, and we should move in that direction. Those are issues that are not a part of the health care bill, actually, for this House provision that I mentioned that we're going to vote on later this week. And at the beginning of the call, I also mentioned, too, that if you do have a job and you lose your job, you should be able to keep your health insurance and have it be portable. It means you take it with you. You don't have to go on COBRA. You'd take it with you and be able to keep that health insurance, for instance, while you might be looking for another job. And I know a lot of people I've talked to that have been laid off and unfortunately have to be looking at finding a job of some sort to have health insurance. So it's very significant. Steve, I think we've got Steve on the line. If you're still with us, Steve?
Yes, Congressman Paulsen, I really appreciate you taking your time and being gracious with us with answering your questions. I'm one of the few people on the line that is very much for hoping that the Democratic plan gets passed, and I'm hoping that we do have a publicly funded option or a public option. But I wanted to ask you this question, and
sure.
And asking for your question in the most honest, nonpartisan way. What is the impact of not doing anything for the next 3 years? If and truly Republicans don't have the numbers, if Democrats have the numbers, Republicans don't, what is the cost to the American public, or what is the impact to the American public if we just keep things status quo over the next 3 years? An honest assessment. I don't care about if the bill is 1,000 pages or 2,000 pages. That's kind of irrelevant to what I pay for health care right now. So just, sure. I didn't vote for you, but please give me your honest opinion.
Yeah, well, no, and that's a good question. And believe me, I do talk to people that, are advocates for having a public plan or a public option or even a single-payer system, and moving in that direction, like Europe or other countries have had. The ramifications are this. If Congress does nothing, if nothing happens, the ramifications are costs are going to continue to rise. That's unacceptable. The status quo is unacceptable. And, I talk to too many families, I talk to too many individuals, I talk to too many small businesses that want to provide health insurance for their employees because it's a work quality of labor issue. They want to attract the best employees. They can't provide health insurance. It's too expensive. They don't get as high quality a worker. I talk to too many of those folks that are seeing their costs go through the roof. And that absolutely has to be changed. So that's the consequence of doing nothing. So it is critical to do something on health insurance and health reform. Personally, I just don't think that the bill that Speaker Pelosi is pushing through is the right approach. But you know what? The status quo is unacceptable as well. And we really need to bend the cost curve in a different direction. And then when I say that, I mean, for instance, focusing on chronic disease management and wellness and preventative care, you can absolutely save costs down the road and save money. And a lot of our costs are directly attributable to diabetes and chronic disease management, heart conditions. If you catch those things at an early age, if we reimburse our physicians and our healthcare providers on treating patients earlier and catching these things on quality of care as opposed to just on the number of procedures that they provide, we absolutely can save money down the road. But the status quo is not acceptable. So I'm glad you raised that out because despite the difference that I might have with the approach that's being done, the status quo is not acceptable as well. Again, we'll take a quick poll. If you support the current health care bill that's going through the system right now, and we will vote on this in the House by the end of this week, likely Thursday or Friday or Saturday. Again, they're about 18 votes short is kind of the rumor to pass the bill, and then it would go to the Senate. Press 1 on your telephone, but if you don't think it's the right approach, you think it should be a different approach, press 2. And I know there's a lot of different approaches out there. You know, Republicans, I think, have like 5 or 6 different ideas that are out there, and you know, I don't agree with all of them. I have a couple of my own ideas that I'm on comprehensive insurance that I'm supporting. But I appreciate it very much in getting that feedback. So dial 1 if you support it, dial 2 if you don't support it. And it's good feedback. I think we've got Kyle on the line, if you're still with us, Kyle.
Yes, I am.
Thanks for waiting.
Thanks for taking the time to do this. I have 3 questions. The first is you mentioned a tax in, I thought you said as early as January of this year, and I'd be curious to know where that tax would be coming from. And then number 2, I did see the bill on your website, but like you mentioned, it's close to 2,000 pages long, and it's rather lengthy to get through. Is there some kind of an abridged version to the read?
Well, to my knowledge, there's no abridged version, and unfortunately, a lot of this, you know, the bill is in legalese, right? I mean, it's been very difficult for myself and my staff to even actually get through it in particular. So I apologize for that frustration. I do think as it gets more sanitized or looked over in the next couple of days in particular, especially by Wednesday, I'm guessing that you're going to see more, you know, if you will, talking points on the bill for sure. So I'll just mention that. Now, my understanding is, though, it's actually, if this bill passes right now, it actually probably will be too late because of the tax forms going out by the IRS. It might be too late for the taxes to be imposed for 2010. And so, you know, I mentioned that earlier. That was actually the first bill that was proposed in August. So taxes would actually start, taxes would probably actually start in 2011. There's about a 5.4 surtax on income earners of $500,000 and above, I believe. And again, as I mentioned, about a third of those are small businesses of those people. And you know, just to mention that. And then you know, there are other penalties if someone does not provide insurance or buy and purchase insurance as an individual. There are small penalties as well and surtaxes as well. I think it's 2.5% tax on individuals of some sort. And so there are going to be other onerous provisions that we're going to be seeing in the near future. And so I just want to encourage everyone, again, to go. You can go to my website, look for a link, get a link of the bill. You can go to the local library now and get a copy of it if you really want to pour through it. And more importantly, if you have a question specifically, just stay on the line. If you're in line to ask a question, stay on the line and ask a comment or a question. You'll go into a queue, and we'll get back to you within 24 hours, or call my office locally at 952-405-8510, and all my contact information is on the website. You can reach out to me because that feedback is really, really helpful to me, and we're going to be doing some more of these Tele-Town hall meetings in the next couple of days to reach out to people. So I just want to thank all of you for the privilege not only of representing you, but more importantly, for your feedback, which helps me represent you. And I don't have the answers to everything. I'm just trying to approach everything as thoughtfully as I can and apply some common sense. I know I get really frustrated. I'm not someone here that just throws up his arms, though. I'm going to keep working hard at finding the right answers and the right solutions to some of these real challenging issues on the economy and healthcare in particular. And I'm fortunate to have the opportunity to represent you. And I know that if I keep getting your feedback and input, I'll only be able to do a better job. So thanks for joining tonight. We're going to have to wrap up. If I didn't get to your call, though, please stay on the line. You'll automatically guaranteed be going into a voicemail, and we'll get back to you within 24 hours with specifics on the legislation. Thanks for joining, and please absolutely stay in touch.
The Teleforum has ended.
Thank you again for participating in my telephone town hall meeting tonight. I'm sorry I was unable to get to everyone's questions, but please, if you'll leave me a voicemail with any questions, comments, or concerns that you have from the call this evening, someone from our office will be sure to get back to you very soon. You can also contact my district office anytime at 888-405-8510. Thanks again, and also thank you for the privilege of serving you in our district.